Hello, Dr. Dilip Gude here, physician, Yashoda Hospital, Somajiguda. We'll discuss about the use of sugar, basically, in our diet. Can we really completely stop sugar? And what are the benefits you can get out of stopping sugar? So, sugar is not something which only diabetic patients should avoid. So, basically, in fact, everybody, if possible, whether you're obese or not, if you have high body weight, high BMI or not, if you're hypertensive or not, if you are pre-diabetic or not, or even non-diabetic or not. So even if your cholesterol levels are very high, or even if they are normal. So sugar is something which is to be stopped, or the use of it be reduced as much as possible. Because there are so many problems that just taking sugar, simple things like taking sugar in your coffee or tea can definitely add up lots of calories to your body, to your per day calorie requirement. And these calories, basically these calories from the sugar, they actually go into the body, and all this sugar actually becomes fat in the body, especially when you're not working out, when you're not utilizing these extra calories. So taking in more sugar, be it either sweets or even jaggery or honey, for example, especially diabetic patients should avoid honey as well, because people tend to think honey is safe, but that is really not the case. In fact, one spoon of sugar, 1 spoon of honey is actually equal to 3-4 spoons of sugar. So honey is really highly concentrated form of, it is highly, fructose and glucose galactose containing, syrup. So it is to be stopped as well. So what really happens? How are you benefited if you stop sugar? You're basically, when you're cultivating this habit, whether you're diabetic or not, whether you're obese or not, if you're trying to cut down the use of sugar, so your body is basically getting benefited by use of not taking a lot of sugar, because it's going to utilize this fat that is present in your body. There is fat mobilization that occurs. Then over a period of time, insulin sensitivity will improve. Even if you are not a diabetic, it is imperative that your body fat is less than desired. Your body mass index is less than 23, especially in Indians. And if you are obese, you need to come into the overweight, or at least a non-overweight or obese bracket, that is 19 to 23 body mass index. So cutting down sugar actually helps in many, many ways. Basically, in fact, it is also shown to, just cutting down sugar is shown to minimize your risk of getting diabetes by probably 20 to 25%. So even if you are predisposed to getting diabetes, just stopping sugar will postpone the onset of diabetes by probably 3 to 4 years. So taking in sugar is something, the sugar rush that you get, it also affects the brain functioning of brain as well. In fact, sleep is also known to be altered if you're taking a sugar rush, giving either liquid or a sweet at night. So sugar rush is something we all need to avoid, and it may be hard in the first week or so, but stopping sugar is going to really help you over a period of time from various problems, metabolic disorders. In fact, not just diabetes, but dyslipidemia, because all the sugar that you take becomes fat, and becomes cholesterol as well. Your LDL levels may rise over a period of time. You might become a prehypertensive or hypertensive as well. So stopping sugar is definitely the need of the hour, and stopping anything with sugar in it, either sweets, or the colas, for example, all the soft drinks that contain enormous amounts of sugar. If you're going to stop that, if you develop this habit of stopping these sugary foods, it's definitely going to help you in the long run minimize the onset of metabolic syndrome, the onset of diabetes, hypertension, dyslipidemia, that is bad lipid profile, etc. Thank you.